Only children and teens are affected by Sever's disease. The heel pain occurs when the heel bone is growing. The area surrounding the growth zone of the bone is during this time calcium deficient and is therefore not as strong. Growth zones exist around bones throughout the body. However, the heel bone is more exposed due to the direct contact with surfaces when walking and running.
This is the heel bone, which is in this situation where you have a youngster who is still growing. Then you have this growth plate, which is separating the bone into two pieces. A very small apophysis is called on the back side of the heel, and the rest of the bone. And on the apophysis, on top of that, or on the back of it actually, there's a very large tendon, the Achilles tendon is attached to the apophysis. So that means that when this very active person are under some kind of sports, there's a high demand, a high degree of stress on the apophysis.
Sever's disease is most common with kids active in sports or activities that involve a lot of running and jumping, especially on hard surfaces such as football, gymnastics, tennis and track. During the last 10 years, the occurrence of Sever's disease has increased significantly. A recent Danish study indicates that Sever's disease will affect 6% of children at the age group 6 and 14 for some stage for a short or longer period of time. Why are we seeing such an increase in cases of Sever's disease? To be honest, we are not entirely sure. However, we believe that these facts can help explain the development. Competitive sport is introduced at an earlier age. We have seen an increase in frequency of matches played during a single day or weekend. Seasonal breaks no longer exist, as most sports are played all year. Children often participate in more than one sport. Surfaces have become a lot harder with the introduction of AstroTurf. And lastly, some children might also be too passive during their spare time, which result in a large contrast between many hours being passive with iPad and computers versus organized sports. Sever's disease can vary in strength and severity. Some children might only experience mild symptoms over a short period of time, others a mild to moderate degree of pain for a longer period, and lastly, some will be severely affected and experience heel pain for several years. An early indication of Sever's disease is often displayed by pain or tenderness in one or both heels during or after physical activity. When Sever's disease worsens, the child will start to experience pain during sport activities and will most likely not participate as actively as usual. The pain is further aggravated when there's too little time to recover between each training session or competitions. The child may be so troubled by pain that he or she cannot participate or complete the activity. Most children will at this stage start to tiptoe and limp. A break from sport activities will help, but the pain will return as soon as the sport activities resumes.
Traditionally, it has been the preferred treatment of this condition, that you prescribe some kind of course, 2, 3, perhaps even 4 months for these young people. But in my opinion, this often gives more problems later on, because these young people are normally very sportsly active. And that means that they have to go back to the same degree of sport in a later phase. And when they do that, after a 2, 3, 4 months pause from the sport and that level, we often see that they get pain again at the same spot where they had before. But more important is that they get other injuries, for instance, groin pain, ligament injuries to the knees, because they're not capable of doing sport in the same way as they were before, because they had this long period of not doing anything in the same manner. So in my opinion, it's much more important that these youngsters in some way are kept in the sport